All right, guys, so I'm picking up with breastfeeding. Let's think about where Connecticut falls. In Connecticut, we have 79.1% of women have ever breastfeed, meaning at least have done it once. And then we drop to less than 50% who are breastfeeding their babies at 6 months, and less than a quarter are actually in Connecticut breastfeeding at 12 months. The recommendation is to breastfeed for a year. It is totally recommended to go all the way up till 2 years. That is completely recommended and nutritively sound for the baby. When you look at these other statistics, exclusively breastfeeding, so the mom who hasn't introduced any formula, hasn't introduced any foods at 6 months of age, is only 12%. We really should be striving for this number to be much higher. Means, are we supporting women well enough? Are we educating them well enough? All of those questions sort of exist. And you can see where Connecticut falls compared to the other states. This is data from 2012. The 2013 data has shown no improvement, unfortunately. So I asked you guys to come prepared to class with these answers, and we will start with this. So please make sure you have targeted answers about these. Positions we covered, really the cradle and cross cradle hold are what most moms will do. This lying down position is more for once the baby gets to be a couple of months of age and can turn like that. And this football hold is helpful for a woman who's had a C-section. This is a baby who's probably more like 2 months of age doing the side lying position. This is great for moms in the middle of the night when they're nursing to be able to still lay down themselves. But again, the baby at a newborn stage is going to be too small to accomplish this position. So we've talked about positioning. Correct latch on, the baby has the areola and the nipple. Really important, the lips are flanged out. That's a correct breastfeeding position. And it's showing you what's happening, how the baby is not biting, but it's using its tongue and using its gums to get that milk out of the breasts. Avoiding nipple confusion. So it's really recommended to avoid a bottle or a pacifier for the first 2 weeks of life because the baby is getting used to in those first 2 weeks breastfeeding. It's new to the baby, it's new to the mom. And all we can do to encourage that bond and encourage her that, hey, this might take 2 weeks to feel really comfortable with, and that's normal, will really help her confidence as she's going through breastfeeding. So avoiding any bottles and avoiding any pacifiers for those first 2 weeks. So clearly a mom who's going back to work at 6 weeks postpartum might want to introduce a bottle at week 3 or week 4 of her own breast milk that she's pumped. That's totally fine, just don't do it in the first 2 weeks. So cup feeding, there are sometimes babies who have a hard time latching on to mom's breast and mom has pumped, and to avoid nipple confusion, try to do a cup feed. A lot of breast milk is wasted this way because it's going to dribble out of the baby's mouth, but still can be a way, it's going to take a while, but can be a way to effectively avoid nipple confusion. This is another way to try to avoid nipple confusion. This could be in a mom who needs to pump for some reason or the baby has a poor suck. And so this system is allowing the baby to be latched on but automatically get milk flowing through this tubing system and not have to work so hard at the actual breast, but again is still getting the sucking motion down at the same time that the milk is flowing. So I want you to look at this position and look at the baby's bottom lip and think about what's wrong in this image with the latch. And then it's really imperative, breast or bottle feeding, to make sure the baby gets burped afterwards. And all of these positions are acceptable burping positions. So the first few weeks at home, I just touched on, right, that it's going to be a learning curve for baby and mom, and reassuring mom of that is going to be so helpful in her breastfeeding journey. And telling her that as the baby has growth spurts, it's going to be normal that baby wants to eat more. So at week 2, at week 4, when this baby is growing, if you feel like all the baby wants to do is nurse, that's normal. The baby is purposefully doing that so that it can put on its weight. And then thinking about talking to her, we talked about when she has to go back to work, that breast milk expression with a pump is an option, how to store it, and then going through those common breast problems that we talked about and educating her of signs to look at. No matter what, guys, if mom is sick, she should still breastfeed her baby. She's not going to make the baby sick by breastfeeding. She still breastfeeds. And then concerns with bottle feeding, we want to just make sure that parents are cleaning the bottles well. And really the education point here, not to overfeed their baby, okay? Really important. And to ensure that this woman has gotten adequate education about breastfeeding. We didn't talk about it in class today, but we will bring it up on Monday. The issue of women who have a history of sexual trauma and how if that trauma related around their breasts, that breastfeeding could be incredibly challenging, and we want to be sensitive to that if somebody is educated and still decides not to breastfeed, to respect that decision. We said that solids should be introduced at 6 months. I know that the Academy of Pediatrics says, American Academy of Pediatrics says 4 to 6, but we're really pediatric and maternity wise pushing to go those 6 months. And then supporting the woman once she goes back to work. She needs the time and space while she's working to be able to pump. So it is possible if she's working from home. It's also possible if she has a toddler at home. She's going to be nervous about how this integrates with her toddler, but saying, have a box of toys that's specifically for that toddler while you're nursing, something new and exciting that the baby gets to use then. And then twins, it's possible to tandem nurse. This woman is doing that in the football hold. And this is showing more twin positions. And yes, a mom will make enough milk for both twins. Breastfeeding during pregnancy is also completely acceptable as long as the woman, right, so when is it contraindicated? As long as the woman is a low-risk pregnancy, it's fine. If she develops preterm labor, we don't want her to be breastfeeding because that oxytocin rush could stimulate labor if she's already at risk for preterm labor. Normal, healthy mom, totally fine. Contraindicated if she has preterm labor. Clearly, her nutritional needs are quite large if she's breastfeeding and pregnant. And it might be uncomfortable as she is first trimester and then uncomfortable as her uterus is growing. And then I really do recommend that moms can breastfeed all the way up until 2 years of age. I think it's nutritively supportive. Most moms, after a year, will breastfeed first thing in the morning and right before bed. It's soothing for them. It's soothing for their baby. But we sort of want to think about our thoughts about that and what biases we bring to that conversation, and just think about that for yourself. And then tandem nursing, if mom is nursing 2 children, her toddler and her baby, we want to make sure that the baby goes on first and the baby gets enough milk first before the toddler goes on. And then this is angliolosis, the tongue tie, guys, and you want to think about that and how it affects breastfeeding. And I will answer any questions, but keep calm and nurse on is the bottom line from all of this.